Hi, good afternoon everyone. I'm Ashish Pandey. I'm a consultant psychiatrist based at Helston Hospital and Community Mental Health team. Today I'm going to give a short presentation on psychosis, and I'm very keen on taking on the questions. How I'm going to do is, the summary would be, yeah, I'm going to talk to you about what is psychosis generally, what are the effects of psychosis, what is the cause of it, how do we diagnose it, and what can be done to help, and essentially what the friends and family members can do to help the situation. And if our technology helps us, then I've included a short video as well, which was released on the occasion of National Psychosis Summit in April 2014, and then following that I'll take on the questions from everyone here. Okay, now what is psychosis? Psychosis is essentially a state of mind where the person experiencing it tends to interpret events differently as compared to rest of the people who are not. Now, this can be as a result of lack of insight, person experiencing psychosis, and essentially what causes it or how does it affect is the person experiencing psychosis might experience hallucinations, delusions. They may come across as confused, disturbed in their thoughts. They might even lack insight or self-awareness about the situation. They might experience anxiety, extreme anxiety. They may feel scared about the situation, frustrated, angry about it, experiencing it. They might feel victimized. They might feel mistrustful about the situation, about what is going on in their mind. They might feel persecuted, alone, depressed, and even tired. Now, what causes psychosis? Now, the answer is we don't know what exactly causes psychosis, but with the research and experience we have had so far, generally speaking, we have divided mainly in three categories what may be the cause of psychosis. So, one of the causes of psychosis is psychological or mental health conditions. The other ones is general medical conditions, and the third and the most important, which has caused a direct impact on the psychosis, is use of alcohol and substance or illicit drugs. So when we talk about the mental health conditions, most common conditions which results in psychosis is the schizophrenic illness, bipolar affective disorder, severe depression, severe stress and anxiety, even lack of sleep, and in some cases in dementia, psychosis is experienced. In medical conditions, the most common medical conditions we come across is epilepsy, but it is also quite common in HIV or AIDS. We do see psychosis in brain tumors, people having brain tumors experiencing psychotic symptoms. And at times, psychosis is the first presentation of organic condition as well, which we see in our general hospital, Norwich, where we have a referral about a person experiencing psychosis. We go there, we take the history, and it is quite acute in onset. There is no family history of psychosis. The patient had been well, and all of a sudden they have started experiencing psychotic symptoms. We refer them for a CT scan or MRI. We find that there is a brain tumor affecting a particular part of the brain, resulting in psychotic symptoms. Now, psychosis is also associated with MS, multiple sclerosis, Parkinson's disease, syphilis, and lupus, which is not very common, but yes, it is one of the causes of psychosis. When we talk substance misuse, alcohol and cannabis misuse seems to have taken the topmost cause for experiencing psychosis in young people and youth. Practically all the substances are related with experience of psychosis, but I've listed the main ones, which is cocaine, amphetamine, MDMA, ecstasy, LSD, magic mushrooms, and ketamines. Now, how is psychosis diagnosed? Most common presentation is the GP is the first point of contact, where GP tends to do initial assessment, and depending on the severity, GP would refer to either access and assessment team now, which is there in function, and access and assessment team would direct or signpost the patient to either early intervention team, which is essentially for the adults between 18 and 35 experiencing first episode of psychosis. Now, the rationale of the early intervention team is duration of untreated psychosis. There had been a massive research throughout the world which has come to conclusion if the psychosis is recognized earlier and if it is treated earlier, then which is essentially duration of untreated psychosis, the outcome of the illness is much more better as compared to the one which is not treated. Then it could be either referral to community mental health team, and like we discussed in previous lecture, that what a mental health team comprises is of essentially doctors, psychiatrists, nurses, social workers, as well as occupational therapists. And recently our trust have introduced, which is very new thing to us, is peer support workers. These are people with lived experience. They have themselves experienced the mental health problems. They are working within the teams, giving better insight to the teams as well as for the patients to kind of recognize from their own experiences. Now, depending on, again, the severity, the referral can be done to the crisis team as well. If an urgent attention is needed in the form of daily visits, acute medication management, which cannot be dealt by the community mental health teams. Regarding treatment support of psychosis, one of the treatment is about medications. We talk about antipsychotic medications, which come essentially in the form of oral tablets as well as depot injections. The other form of treatment would be psychological support. Now, cognitive behavior therapy in psychosis has a good evidence base that it is about talking about the symptoms, understanding the symptoms may help alleviate or reduce the symptoms of psychosis by understanding them. Yeah. Family therapy has been a very important part of treating psychosis because it involves not only the service user or the patient, it also involves the family. It's about making them understand what the psychosis is about, what the person experienced, and how do we help the person who is going through the experience of psychosis. Then we have got social support in the form of social worker. It's about treating effectively a person, mainly if they have education needs, if they've got financial needs, if they've got accommodation needs which need sorting out. It could also amount to the relationship difficulties they might be experiencing at their workplace, they might be experiencing with their friends and family members. And in some cases, when the risks are high, then the inpatient care is absolutely. In some cases, we do need to use Mental Health Act assessment, which is a formal assessment under the Mental Health Act 1983. It is about balancing the nature and degree of presentation with the risks associated with the presentation. That essentially means that if patient is unwell and the risks are high and they are not willing to come into the hospital, then they can be brought into the hospital using the powers of Mental Health Act. Essentially, Section 2 and 3 are the ones which we use most commonly. Now, how can someone help someone experiencing psychosis? Is by going to support groups where the psychosis or the people's experiences are being discussed. Yeah? Looking after yourself, eating well, ensuring that you involve in regular relaxation, you involve yourself in exercises, avoid misuse of substance, avoid misuse of alcohol, especially if you're prone to, and recognizing your triggers. What happens, what causes you stress, what are the situations you could avoid just to not getting involved in those situations, which might lead to precipitation or presentation of the psychotic illness, which comes with experience and which also comes with the family members recognizing altogether what caused the psychotic episode. And always it's important to create a crisis plan. Now, for example, what would happen if one person experienced psychosis? Now, what should be the plan of action? Who are the key persons to contact? Who would they contact? What is the phone number? Is it handy in the hand that they need to contact? Is it the crisis team they need to contact? What if it is out of hours? What if it is a Saturday or Sunday where the routine GP surgeries or the normal community mental health teams are shut? How do we deal in that situation? So key contacts and a plan, a rough plan about what to do if the situation comes across. And what can friends and family members do to help? It is essentially about listening and trying to be sympathetic as well as empathetic. It's difficult to be empathetic, but understanding and listening is very important for someone experiencing psychotic symptoms. It is about focusing on the feelings rather than experience of psychosis, offer practical help in the form of day-to-day activities, helping them with the food, helping them to possibly change, helping them to call people if they needed to. Again, we talked about the plan for crisis, and we talked about the carer support, which is getting help for yourself as a friend and family members. Now, just a few facts about psychosis, how common it is before I take the questions. 3 in 100 people in their lifetime would experience one or other form of psychotic illness. Why it is important to recognize is that 1 in 5 people experiencing psychosis would self-harm in their lifetime, and actually 1 in 25 people would actually commit a complete suicide. That's why it's very important to recognize, identify, and help people experiencing psychosis as well as their carers. Yeah. Thank you very much for listening to me.
Thank you very much, Dr. Pandey.